So, ma'am, I think many participants has been joined, and I think we can start the session. Ma'am, I'm starting the session with your permission, ma'am.
Absolutely. You are the lead here. I am just a participant.
Uh, Thank you, ma'am. So, very good morning, good evening, and good afternoon to everyone joining us from around the globe. Welcome to the webinar titled Vision Beyond Borders, Exploring Global Insight for Advancing Optometry Practice in Bangladesh. My name is S.M. Abdullah Mamun. I'm the consultant optometrist and low vision and contact lens specialist from Chittagong Eye Infirmary and Training Complex, Bangladesh, as well as the former General Secretary of Optometry Association of Bangladesh. I'm honored to serve as your host for this event. This webinar is a collaborative initiative to bring together global experts in optometry, share knowledge, and explore opportunities to advance optometry practice in Bangladesh. We are thrilled to have an esteemed panel of speakers, including our Honorable Professor Emeritus Dr.Sandra Block, ma'am, who is the President of World Council of Optometry since long time, Dr. Rajeev Prasad, sir, President of the Asia Pacific Optometry Council and Board of the Director of World Council of Optometry. Dr. Naimah Ebrahim Khan, academic leader at the University of KwaZulu-Natal Discipline of Optometry, South Africa. Dr. Anitha Arvind, ma'am, PhD and associate professor, as well as she's the head of optometry of the GD Goenka University from Gugaon, Haryana, India. Dr. Ahmed Barakat, PhD optometrist, senior optometrist, as well as he is the ocularist of Global Eye Care, Cologne University, Cairo, Egypt. Dr. Raghda Faisal Mutwaly, consultant optometrist and assistant professor of optometry at Qassim University, Saudi Arabia. Dr. Gaji Riaz Rahman, PhD and former president of Optometry Association of Bangladesh and CEO and consultant optometrist of Dhaka Optical Pavilion. Mr. Abid De, the current president of Optometry Association of Bangladesh. Mr. Delwar, consultant optometrist, Smart Eye Care and Myopia Center. Before we begin, I'd like to extend our gratitude to our media partner, Eye Doctor TV, and our sponsor, Mr. Abir Ophthalmic, for their unwavering support. Let's now officially begin the webinar with the first segment, which will be coordinated by Dr. Gaji Riaz Rahman, who actually will give you the insight of the real scenario of optometry in Bangladesh, which has started since 2010. And I think through this session, you will have a detailed insight or scenario of the optometry of Bangladesh. I would like to request Mr. Dr. Gaji Riaz Rahman to start with his presentation, and as well as if anything required from your side, please let me know. Yeah, you can share your thank you.
Yeah, first of all, it's been an honor for me, and I'm so much privileged that I'm sharing the scenario of optometry in Bangladesh. So this has been a great honor for me for sharing this in front of some legendary persons of this field across the globe. And I am extremely happy that you all are waiting for knowing the exact scenario of Bangladesh of optometry right now. So here I'm sharing the topic today. So today we'll discuss about the optometry in Bangladesh and where we stand right now. I am Dr. Gaji Riaz Rahman.
Thank you so much for having us. And I must say thank you very much to Dr. Rahman. That was a very, very good overview. And it gives me nice insight. I actually didn't know much about optometry in Bangladesh. So thank you very much for that. I am speaking to you from the east coast of South Africa, from Durban. And as mentioned, I am the head of department at the University of KwaZulu-Natal. In South Africa, there are 4 institutions that actually offer optometry. And of the 4 institutions, the way our program is structured is very similar to what was described just now by Dr. Rahman, in that we offer a Bachelor of Optometry program. And thereafter, if someone wants to do postgraduate studies, we also offer a Masters of Masters of Optometry, which is a research master's. And then we also offer a PhD, okay, which is also a research PhD. So for us, when our students graduate, they graduate with a B Optom. And for them to gain the doctor title, of course, they need to do their PhD. So they get to that level and then they're the doctor. A lot of our people are based within, or our students come from South Africa and Africa. We do have some international students as well that come through to do postgraduate studies. And what else did you say? Am I missing something? Oh, yes. When we have foreign graduates, they need to, when they apply, they apply to the SAQA requirements, because in South Africa, optometry is regulated by the Health Professions Council of South Africa. And we have the Optometry and the Optical Dispensing Board, who actually give us all our requirements and what we're needing to do. So it's standardized across all 4 institutions that actually offer a B Optom degree. I'm not sure if I've covered everything, Mr. Mamoon, Chair. If you want to maybe just remind me if I left anything out, please.
No, ma'am, yeah, you are going very well, and all the things are coming within that, because each and every words are valuable. So it's not a big deal, but I think it's a big thing for us. You can say of your own. Thank you.
Okay. All right. Thank you. Thank you then for the opportunity. But if there's anything else that anyone wants to ask about South Africa, I'm here.
Yeah, ma'am. The insight of South Africa, we got to know from you, because in the world there is a country named South Africa. Always get to know the cricket, football, and each and everything, but the condition of optometry was really unknown. So through your point of view, we really get to know the condition, and I think in our further meeting, we can proceed to talk with you regarding if there is any support we get from the South Africa region for the optometrists, because the optometrists of Bangladesh are really eager to upgrade their professional knowledge and each and everything, because only the graduation program is available over here. The masters for masters and the for PhD program, they need to go outside of Bangladesh. So I think we will also get the support. If anything required, your suggestion and each and everything will be valued, ma'am.
Definitely, that's fine. Yes, they can approach us, and I'm happy to discuss further in future meetings. Just let me know what you need. Optometry, we've actually had quite a few graduates from India and Bangladesh as well, actually from all over the world. So yes, that's nice to know. Thank you so much for the opportunity.
Thank you, ma'am, for your presence, and thanks again for giving us the insight of South Africa. And I think we'll get you in our future meeting as well, ma'am. Thank you. So right now, I would like to request Dr. Anitha Arvind, ma'am, PhD optometry, and she is also the associate professor as well as the head of the optometry department of GD Goenka University, Gurgaon, Haryana, India. So I'd like to request Honorable Ma'am to give your valuable insight, or if there is any suggestion regarding the optometrist of Bangladesh as well as the scenario of optometry in India. Thank you, ma'am.
Yeah. Thank you so much. And I wish each one of you a very happy 2025 too. And thanks, Dr. Rahman, for giving us an oversight of the state of optometry in Bangladesh. Though it is in its initial stages, it's quite young in comparison to optometry in India. It was started only in 2010 in Bangladesh. And from the presentation, I get to know that it's making great progress, as Professor Sandra Block mentioned earlier. So it's going at a great pace too. The very fact that you have brought people from across the globe for this occasion today itself speaks volumes about the efforts that are going in Bangladesh towards upgrading the status of the profession in the country. So in India, like Dr.Naimah just mentioned, we do offer the 4-year bachelor's program, the 2 years master's post-graduation program, as well as the doctoral studies. In fact, I would like to add, Dr. Naimah, I did my doctoral studies from University of KwaZulu-Natal, so it's a very small world indeed. Regarding optometry, in India, it's soon to be regulated. So, of course, given the size of the country, we are a 1.3 billion plus population. So you can understand with this and the geographical situation of the country, also there is unmet needs of the population too. Of course, the ratio doesn't match. We have the urban and the rural divide too. So we still have a long way to go in India. Of course, there has been considerable progress as far as the profession is concerned in the recent past, with a lot of activities in terms of conduct of conferences at the international level. Presence of Indian optometrists globally has also gone, has taken real great strides, I would say. So likewise for Bangladesh, I would only suggest that the only way to maintain the quality of optometrists is to organize frequent seminars, webinars like these, or conferences to keep all optometrists upgraded and to meet up to the global standards. WCO has set up good standards for optometry, whether it is a regulated or an unregulated environment. So we can all emulate from what WCO has set standards for us and try to follow, and not just be very restrictive. Each country has its own unique challenges. So it's very important that we understand the unique needs of our country or our geographical region and try to meet to the demands of the population. So on that note, I would like to wish the Optometry Association of Bangladesh all the very best, and I see a very bright future for the optometrists in the country, with leaders doing great work in Bangladesh. So all the very best. And any help that is required from my end, I'm more than happy to help.
Thanks a lot, ma'am, for your wonderful insight. Because when I seen Gurgaon, Gurgaon is a very favorite place to us because Gurgaon and Haryana. We was there in India from 2018 to 2020 for our masters in optometry program in Ahmed University, Haryana. So we stayed there for 2.5 years, and it is a really emotional place for us. And I have seen you in many conferences and in many speeches. We are a great follower of you as well as for the educational contents, and wish you all the best,
Thank you
ma'am,
so
for
much.
your future
Thank you.
progression. And I think we'll get in your future steps. Thank you, ma'am.
Thank you. My
Dear
pleasure.
audience, thank you, ma'am. So, dear audience, right now we are coming towards our honorable country leader as well as the president of Asia Pacific Optometry Council, who is also who is also the director of World Council of Optometry. Our honorable professor, Dr. Rajeev Prasad sir. For giving his insight for this program, as well as he is a legendary person for us, because from the Asia Pacific region he is also representing the optometry of this region. So please, sir, give your insightful thoughts towards us so that we can inspire. Thank you, sir.
Hi, good evening all, and Happy New Year to everyone. Forgive me in case there is some background noise coming in because I'm in the middle of something, and I'm traveling, and I'm at this moment I'm at a place like world's biggest congregation, Kumbh Mela. I don't know whether you all have heard, but that is in River Ganges where everybody gets a holy dip. So I'm here outside in the venue. So pardon me for this little bit noise in case you get. So you know I mean, it's definitely a privilege and honor, to, join you all in this webinar, theming Vision Beyond Boundaries. And as a president of Asia Pacific Council and secretary of Indian Optometric Association, I can just say that, to align the initiative with the World Council, to advance access, quality, eye care and healthcare worldwide. That's what we aim on. And, this event, what you have crafted, I would say is, this event also resonates with the international IAPB's outgoing efforts on Specs 2030, where optometry has a big work project to do. And probably for the first time, I would say Sandy would also agree that Specs 2030 has really recognized optometry in a big way, emphasizing sustainable development, quality, equity, and universal eye health. And With Bangladesh, I can say, with your rich cultural heritage and, vibrant communities, present unique opportunity and challenges in delivering accessible and equitable eye care. I mean, I have been, talking to, various colleagues of mine from Bangladesh, and I can say, the future is really bright. You all are really working hard, and your nation's commitment, improving eye care. And I was just listening on, diabetic eye health program and other program which you're working on, uncorrected refractive error. It is still a lot needs to be done because the demand is huge for the comprehensive eye care services and to integrate optometry into the border of, healthcare system. I think the only way to get to is, through collaboration, shared expertise, and innovative solutions. We can definitely support Bangladesh's journey towards achieving sustainable and inclusion vision, care for all. I think it's high time that we discuss, we share, we collaborate, and we grow further. I'm not from a university, but yes, I mean, I have my own prior practice on specialty, and I have five branches in the country in different zones, in Bihar, in Jharkhand, two in Delhi. Recently, May we started in Gugaon, and next month we are starting in Lajpat Nagar in Delhi. And existing one is in Noida. It is all about specialty, and all the specialty which you can think of and you just spoke about. I think it is all about that, right? From low vision rehabilitation to vision therapy to neurooptometry to sports vision to myopia management and all that. And to grow further in terms of education, in India we are launching uh, International Academy of Orthocare and Myopia Control. Myopia is becoming big. World Council is really working hard. Recently we had a collaboration with Cooper Vision, and they have great support. Dry eye is big. If you have not gone through, please go through WCO website. The entire stuff is there. We have, wonderful dry eye wheel, which is there on WCO website. Please share with your colleagues and let us know whatever way we can help. And my practice revolves around specialty. So anybody who's interested to come and see, visit us, learn more, I'll be more than happy. We offer internship also. We offer fellowships also. So I'll be more than glad, and India, Bangladesh, like it is like brother-sister relation. So do let us know what way we can help you out, and we'll be more than glad to help you out with that. If anybody has any queries, please feel free to ask. Thank you so much.
Thanks a lot, sir. Because we the Bangladesh optometrist always glad to hear from the leaders all over the world, and we are really happy to hear your comment towards the culture as well as our recent activities of Bangladesh. And we are really attached with you for the long time through our institution, through our association, and each and everything. You always give us the support with your valuable suggestion. So thank you, sir. And again, we wish we'll get you in our future steps, and your suggestion will make it more furnished. Thank you, sir. Because you
Thank
are
you so
in
much.
a
Thank you so much.
journey, you are in your holidays, and you managed your time for this small community, and we are really honored with that, sir. Thank you. Right now, I would like to request Dr. Ahmed Barakat, PhD, senior optometrist, come ocularist, and who is working in the Global Eye Care Cologne University, Cairo, Egypt. So please, Mr. Dr. Ahmed Barakat, sir, please give your valuable insight of your country, and as well as if there is any suggestion from your side, please. Thank you, sir.
PowerPoint show very nice and this number. Thank you, and thank you for all doctors who show a lot of problems for optometry field in their country. If we wanna talk as the optometry one family and one field, we have to know that optometry field opposite a lot of obstacles in a lot of communities. Uh, Against me, something like against me from ophthalmologists. I don't want to say something bad about them. They are now my colleagues, but they don't comfortable with me. You come to take my job. I wanted to say that I don't come to take your job. I wanted to tell you, although work in ocular procedures and orbital procedures. I don't know if you all know about this or not. Ocular procedures is like this. Yes, I work also in that, and I think it's very important for patients. So I wanted to thank all of you. I wanted to told you that I'm happy to be with all of you. And Dr. Sandra Block, I wanted to make some events or to discuss another time in the future about events in another country, and it will be will make a good for all of us. Thank you very much. Thank you for all. Thanks.
Thank you, Dr. Ahmed Barakat. So I'd like to introduce Dr. Raghda Faisal Mutwaly, ma'am, who is the consultant optometrist and assistant professor of optometry at Qassim University, Saudi Arabia. So ma'am, please give your insightful thoughts about the optometry profession in your country and limitation, and if there is any suggestion for us from your side. Thank you, ma'am.
Hi everyone. Assalamu alaikum and happy
Alaikum
New Year
assalam.
for everyone.
Alaikum assalam.
Actually, so I will start with Sudan. In Sudan, actually, the journey of optometry started more than 50 years, which is very long journey. And actually, we have so many programs. Our bachelor program, 5 years, with some specialties. So we have 5 specialties for the graduating students, which is binocular vision, low vision, contact lens, primary eye care, pediatric optometry, and low vision, and even ophthalmic imaging technique and neurology of vision. So for BSc, the students can get any one of this specialty. Also, we have MSc program in Sudan, and also we have PhD just by research. So in Sudan, actually, I can say it is good communication between optometrists and ophthalmologists, because in our hospital in Sudan, we usually make all the primary examinations in optometry clinic. They refer the patient to the ophthalmologist. So maybe sometimes 70% of exams done by the optometrist. I think it is a baseline for ophthalmologists to make any diagnosis. And as optometrists, we contribute for primary assessment of the eye problems, how to manage the patient, and we have to make some primary diagnosis for some pathological conditions. And we can refer the patient even not for ophthalmologist, even for any other specialty like neurology, if the patient is. So as optometrists in Sudan, we also do many things like preoperative examinations, either for LASIK surgery or even refractive surgery, and even for cataract surgery. All of these can be done by Sudanese optometrists in Sudan, actually. So I think in Sudan, it is going well, the optometry profession now. But there may be some limitations, like surfaces, like the equipment, like the support from outside. But I think we are doing good. When compared between Sudan and Saudi Arabia now, I have 3 years in Saudi Arabia. The optometry program is different, actually, in our university in Saudi Arabia than Sudan. In Saudi Arabia, it is OD, which is like actually like USA. But I think there is some limitations in clinical practical in OD program when compared to our program in Sudan, because there is no exposure so much for the students with the patient during the study. They have to expose the patient in internship the last year, which is very far, I think. But in Sudan now, from third year, the students can expose to the patient clinically. They have to do so many clinical tests. So I think maybe it is better than OD program. I don't know if you agree me or not. So yeah, there is difference between Sudan and Saudi Arabia. But I think in Sudan, yeah, our profession is very, very, very long when compared to Saudi Arabia. We need to incorporate with so many optometry societies in different countries, and also with the World Council of Optometry. So this is a general idea about optometry profession in Sudan and Saudi Arabia.
Our Honorable President, Dr. Sandra Block, ma'am. Ma'am.
Well, good morning, good afternoon, good evening. And the sun has come up here where I'm at. And that really doesn't mean anything to most of you, but the reality is that the World Council of Optometry serves optometry globally. So it really shouldn't make any difference what time it is in my country. I am here to serve as a volunteer within the World Council of Optometry. I want to give you a little bit of background before I go into more details about what we're talking about for today. I want to share that this year, the World Council of Optometry updated our mission and vision. And our vision is accessible eye health and vision care for everyone, which I haven't heard, the global piece spoken by each of the speakers that we heard already, but everybody's insight really talked about how to ensure that our graduates are prepared to do that. Our mission is advancing and promoting optometry, global eye health, and vision care through collaboration, education, and advocacy. So at this point, I wanted to just give you some insight about WCO, or the World Council of Optometry. We will be 100 years old in 2027. So we've been around a long time. The challenges for optometry over the years have been many and very diverse. I know that Bangladesh has hit some, shall we say, small hills over time, even though you are such a young profession within Bangladesh. I have to say, when I listened to Dr. Rahman speak today, I was actually quite impressed by the breadth of the academic program. And the nice thing for Bangladesh optometry is you've begun at a time where optometry has already achieved a certain minimum level of competency that many other countries who have optometry for many years started at a very different point in time. And you've actually achieved what by starting at that mid-level, you've achieved a level of respect from the healthcare professionals already, which is much more so than what happened. So my background is I'm an educator. I retired after 38 years of teaching at the Illinois College of Optometry. When I graduated in 1981, which was probably long before many of you were born, my degree said I could not use any pharmaceutical agents at all, that the opportunity was I could do whatever I could do without the access to many of these higher levels of investigation that we all expect of every graduate of an optometry program now. So clearly Bangladesh has done an amazing job in ensuring that your graduates are at that level of competency that we would expect for the current state of optometry and eye care access. So congratulations on that. I know that many of the speakers have not, that they started more like the US program started and have achieved many, many accomplishments, but it has taken a lot of great work. And WCO is all about helping countries advocate for regulation, acknowledgement, better academic performance, ensuring that our graduates have places to go. I did hear a little bit about one piece that I think is really important for optometry as a profession, and that is the importance of staying abreast of current methods and research associated with understanding the visual system. Continuing education or lifelong learning really is very important. I was at the American Academy of Optometry a couple of years ago when an ophthalmologist spoke at a keynote session, and he'd only been out of school for about 15 years. And he said, what he learned when he graduated is no longer the standard of care. So what it reminds us is the importance of each of us to stay abreast of what the current state of research is. And I use that to lead into, it's been 5 years since the World Report on Vision was released by the World Health Organization. And it wasn't until that report actually launched that the visibility of optometry became broader on a global scale. And the acknowledgement from both WHO and the International Labeler Organization of us being the purveyors of primary eye care. The realization that there are not enough individuals who are trained to provide eye care, going all the way from community service to tertiary ophthalmology. There's not enough people out there to be able to deliver the needed care for those billion people who have preventable vision impairments. So it opened the door for optometry. If I had my druthers, and that's a very American word, if I had my choice, I would love to be starting as an optometrist now, because the doors are wide open for us to make such a significant difference in the delivery of eye care. We know now we are recognized as a primary eye care provider. And I was very happy to hear that Dr. Rahman talked about in the definition of optometry. So thank you for opening that door. We are no longer simply people of just providing refractive care. That is no longer what optometry stands for. We are sort of a opportunity to do a number of things, and we need to make sure not only do our students know it, but our colleagues understand it. And one of those things is, number I don't know how that happened. So interesting.
Now it's okay, yeah.
So it's important for us to realize that we are now at a position where not only are we dealing with basic eye care services, primary eye care is a much more global piece. We have to think about the fact that the eye is a window to the rest of the body. We know that things like glaucoma, macular degeneration, diabetes are all growing because our populations are aging. And as people age, there's more diseases. We could be the resource for even not only addressing the refractive state, but ensuring that eye health conditions are identified early on so we can prevent long-term vision loss. But we also have the opportunity to be aware of other conditions, more systemic diseases. We're at a place where optometry is an important part of the healthcare team. And WCOs really wants to see optometry moved away from a siloed profession to part of the global health profession. And if you watch the United Nations resolution, the World Health Assembly, that is all that's been pushed forward, is to ensure that, number one, everybody's aware of what eye care is and what we can do as eye care providers, and to ensure that the movement on a country level is to integrate vision and eye care services into universal health care. That means that not only do we need to make sure that we all stay abreast of the latest research that's come out, but to be able to communicate to the other healthcare providers about what we can do to help ensure the best care for the patient. Remember, our goal is to deal with the patient that we're providing care. We need to ensure the care we're delivering is in the best interest of that patient. If anybody has gone to the International Agency for the Prevention of Blindness to look at what they talk about for patient-centered care, it is important for us to deliver care not what's good for the world, but what's good for that patient sitting in front of us. So think about all those things as we start to develop as a more significant part of the healthcare team. Within that, it is important for everybody to understand WCO is relatively a bare bones organization. We serve more of the country members than we do individual members. However, as Rajeev Prasad has shared, as he is a member of our board, we have resources that are designed to help optometrists globally to build up their skill set and knowledge in a number of different areas. And we oftentimes partner with corporate entities who have the fiscal capabilities to support developing educational streams to improve outcomes for our patients. And we focus on myopia management, dry eye, and our most recent is presbyopia. And those three topics are really important to us as optometry. They probably serve 70% of the patient's needs within our practices. Now, with that, we understand that there are numbers of levels of the way people can practice around the world. And our advocacy programs are there to help individual countries bring up their advocacy and regulation level to a point where they can provide good quality care. And we have to know that there are some optometrists that still function at a very optical level, and others that really practice at a tertiary, or secondary and tertiary level. In the United States and Canada, it is not uncommon for optometry and ophthalmology to collaborate in a practice so that each of the clinicians can work to their highest level of skills and knowledge. And that's what we want to see broaden throughout the world. So with that, I want to remind everybody the importance of ensuring that our graduates are learning at the highest level of possible. And the goal really is to always teach them beyond the scope of what they can practice now. So when each country, including Bangladesh, is ready to go to broaden what the regulatory bodies say you can do, you want to make sure that your practitioners are well educated before that legislation takes place. In the United States, it took 20 years for everybody to go from one state approving care for glaucoma to all 50 states approving care for glaucoma. So it's not a quick process. It's a slow, diligent process where everybody needs to work together as a team. And that includes not only within our profession, but globally as well. So with that, I want to say that Bangladesh has definitely moved forward at an amazing pace. As you've only been around for 15 years now that we're in 2025, and in my mind, you are clearly ahead of many countries that have been around, where optometry has been around for many years. I give you a great deal of credit and congratulate you on your successes. The challenge you have is with a population that's as large as your population is in Bangladesh, there needs to be more development in increasing the number of people who have graduated from a minimum level of 4 years of bachelor's to become optometrists. So while you've done an amazing job, the hill is still very high and you have a long way to go, knowing that the World Council of Optometry is here to help. I will say that we really would encourage all of the countries that may not have realized it to become members of WCO, so you could be a part of our voice to make change. It is very important that we as a profession talk at the same level and we speak the same verbs so that people understand we are truly a profession that is dynamic and well suited to address the issues of preventable vision impairment. And I do want to add one thing. While we know that the focus of the World Health Organization is on cataracts and on refractive error, we cannot forget that it is not our job just to deliver glasses. We have to ensure that every individual is identified if they have any other types of problems so that we look at the person as a whole. One of my fears is it looks nice when you can count the number of glasses that are dispensed, but that doesn't solve the problem that optometry feels is core. We want to make sure our patients can see well and that we identify any eye health or systemic disease that can be identified through a vision exam, that is identified at the time we see the patient. We don't want to miss something that we could have an improvement on. With that, I want to close my verbiage with the idea that it is very exciting now that we as optometry can impact the development of myopia, which is no longer simply a refractive error. It is a disease entity that we can, if we can slow the progression or even prevent the myopia from developing, which means we have to start before school age, we can make a bigger impact in the numbers of people who are visually impaired and blind. So it is incumbent upon us to be part of the solution and not just look at the problem. So thank you all for sitting and listening. It's been a long time. This has been a 90-minute presentation, and I appreciate the fact that you're all here. The World Council of Optometry is here to serve, and we would love for everybody to be a part of the solution. So thank you for your time. Thank you for allowing me to speak. Mr. Delaware, thank you for organizing this. Mr. Mohammed, thank you for bringing together so many people to address the problem. Dr. Rahman, I loved your presentation because it gave me a sense that you're amazing at what you've already achieved, though there's lots more to do. And for each of the speakers that have shared, I know many of you by name and have watched your development of your professional careers. Thank you for contributing. I think the world is ready for optometry to make a difference. So have a wonderful day, and thank you for the thank you for the opportunity to be here to share my thought.
When you planned for the program, it was a very short time to plan for such type of programs, and sometimes it's really difficult to attach the peoples in a single platform. And wherever we are, wherever in the world we are optometrists are having the same motive. We help each others. In our country, we're acting as the specific country leaders, and they are doing a great job for their country. I would like to thank all the participants as well as my special thanks to Professor Emeritus Dr. Sandra Block ma'am for your valuable present in your early morning time, and I hope we will get you in our future progression. You are our guardian of optometry, and your single sentence, single suggestion will make a lot of difference in our country status and in our future step as well. As well as I like to thank Mr. Delawar Bhai, who helped to attach with all the peoples. Without his help, it was not possible to connect with the country leaders of all over the world, even with Professor Dr. Sandy Block ma'am. I acknowledge his dedication, as well as I would like to thank Dr. Gaji Riaz Rahman with his presentation. With that, he just explained in an excellent way the scenery of optometry of Bangladesh.
At least at last, I would
Yes,
like
sir.
to, congratulate
Yes, sir.
the entire team of OAB, Abir, you, Rahman did a wonderful presentation. Delaware at last minute he was running around, and I mean, how much hard work you all have done to make this happen. So I congratulate you all, and feel free to get in touch with us. As Dr. Sandy mentioned, anything from WCO, anything from Asia Pacific Council of Optometry, just let us know. And people who are interested in, getting into myopia management, India, Bangladesh is very close. Join us from 23rd to 25th of May for IUMC. I have already shared the link in the group. And looking forward to see you all even at Minneapolis.
Yep.
And have a great day, all.
Yes,
Have a great
thank
day,
you.
Sandy.
Thank you,
Thank you.
Rajeev.
Bye-bye.
See you
Thank you.
soon. Everyone
you.
have a wonderful evening. Thank you for attending.
Because Bangladesh is a very small country. Just we knocked her, Mr. Delaware, and just the response you can see. She is here with all the team. So she is our guardian, and she will help each and every country optometrist whatever help they required from her point of view, because she is also having limitations, but she is giving her time even in the early morning, and I appreciate